Management of flail chest. The management of flail chest focuses on stabilizing the chest wall, managing pain, and supporting respiratory function. Here is a mnemonic to remember the management approach. Stable chest. Take splinting. Apply external stabilization to the flail segment using a chest binder or a supportive device to limit chest wall movement. Though treatment of pain, administer analgesics, such as opioids or nonsteroidal anti-inflammatory drugs NSAIDs to relieve pain and facilitate breathing. 3. Assess respiratory status. Monitor respiratory rate, oxygen saturation, and signs of respiratory distress closely. Consider supplemental oxygen therapy if necessary. 4. Breathing support. Provide respiratory support as needed, including non-invasive ventilation such as continuous positive airway pressure, CPAP, or mechanical ventilation in severe cases. 5. Lung expansion. Encourage deep breathing exercises, incentive spirometry, and early mobilization to prevent atelectasis and improve lung function. Chair. Elevation of head. Position the patient in a semi-Fowler's position to optimize lung expansion and reduce the work of breathing. 7. Close monitoring. Continuously monitor the patient's vital signs, respiratory status, and chest wall movement for any signs of deterioration. 8. Humidified oxygen. Provide oxygen therapy with humidification to prevent drying of the airways and improve mucociliary clearance. 9. Expectant management. Monitor for complications such as pneumonia, pneumothorax, or respiratory failure, and intervene promptly if necessary. Thus, supportive care. Provide adequate nutrition, hydration, and emotional support to promote healing and recovery.